Let's move now to the Eastern Cape, where some hospitals are struggling to feed patients. This is due to procurement backlog problems in the province. COVID-19 infections are rising in the Eastern Cape as they are in other areas. But now a humanitarian organisation, Gift of the Givers, has stepped in to help. eNCA's Nceba Ntlanganiso is following the story and joins us now. Nceba, it's fantastic that Gift of the Givers is helping with food distribution. You were there at the opening of their warehouse. But of course the question is, how has it got to this point that a charity has to step in to help a government hospital feed its patients?
Well, Sally, there's been several calls that I've been getting as well as a journalist working in this province. Getting calls from the family members of the patients that are in hospitals right here in the Eastern Cape hospitals. And I remember one case in Mount Frere where we were told that there's no food in the hospital, and having to call then Sizo Kupelo, who was a spokesperson who's on suspension as we speak. Now and again he was denying all of that. And now we have proven it actually through Gift of the Givers that definitely they are hospitals in the Eastern Cape, they are running out of food to look for patients. And right here I've got Ali Sabley, who's from the Gift of the Givers, who's going to talk us through about how this came about, to tell us about that. Ali Sabley, thank you so much, sir, for joining us. You've opened this food distribution warehouse right here in East London today. Can you tell us how that came about?
Okay, as we know, we first walked into the Eastern Cape province in February 2019 in Makanda. We were drilling boreholes during the drought crisis. Then COVID-19 hit the whole of the country, and then we saw the real effect of hunger in the Eastern Cape, where in one of our distributions in Perry, a mother very dignifiedly came to us after receiving a food parcel, telling us, I have my 3 children with me, you can ask them the taste of every plant in the bush. That's what they've been eating for the last 3 months. Thereafter, Dr. Imtiaz Suleiman invested in this province in terms of hospital upgrades, in terms of thousands of food parcels distribution. And then came a call in September 2020. That's where the first calls came from the hospital. We require some food for our patients. We don't have sufficient food to carry through the month. Can you please assist us? There we admire the honesty of MEC Meth, where she, in the first meeting with our chairman and founder, Dr. Imtiaz Suleiman, in April, where she said, Dr. Suleiman, I'll be honest with you, in July 2021, the department would have depleted its budget, and the only way the department will carry through is through partnership. And there she treasures the partnership with Gift of the Givers. And in September, we rolled out food to over 30 hospitals. Today, we received the same call for the last 2 weeks, where we found out there's been in the department's procurement process, there's been a bit of a glitch, leaving the delivery of food to all the hospitals in the province, leaving them in a crisis where no food will be delivered to them. The CEO started getting hold of us during the night, during the early hours of the morning, pleading with us for assistance with some food items. And today we had over 42 hospitals, some of them leaving at 3 o'clock this morning to be at our warehouse this morning at 10 o'clock to collect food for those patients, to carry them through the month of December and to carry them through the festive period.
I just want to find out, with the talks that you guys had with the officials of health in the province, for how long you're going to provide food to these hospitals? Can you tell us about that?
Okay, they are busy with the suppliers, with their procurement process. As we know, there's a lot of red tape in government and there's a lot of protocol and processes to follow. So they are busy with their supplier and getting the necessary stuff in order. But while that is taking place, we cannot allow the patients in hospitals, especially those who are recovering, especially those in the poor rural areas, to suffer. So if it's not sorted, if they said by January it should be sorted out, but if it's not sorted out by January, we will then assist them further to make sure that the patients are taken care of, because the last thing you want to, if a patient comes to a medical facility, there's no proper food for them to eat.
Thank you so much, Ali Sablay. That's Ali Sablay from the Gift of the Givers, talking us through of how this came about. Of course, as you mentioned, that the MEC of Health in the province, Nomakosazana Meth, approached the founder, Mr. Suleiman, asking him to come and join in partnership in terms of supplying food in these hospitals. Sally?
Well, Nceba, it's certainly got to a really dire state if they are desperately calling on charities to help them. Have you managed to speak to the Eastern Cape health officials? I mean, it is shocking that it's got to this stage. And have they pointed to what's gone wrong, why they've run out of food? What exactly is the problem? I mean, we need to know what the problem is so that it doesn't keep happening.
Yes, Sally, I've made calls to the health officials in the province, and no one was available to come on camera to talk us through of the situation that Gift of the Givers have told us about. Well, they only responded to me on a WhatsApp message that they've sent after I've asked them. They've asked if I can send questions, then I've sent the questions. Responding on the WhatsApp message, yes, they are firstly disputing that there's food shortages in the Eastern Cape Eastern Cape hospitals throughout there, and they're saying there's no such. It is their priority to make sure that there's food in all the hospitals, and no patient must go to bed hungry. And well, they also mentioned that they do confirm that they're experiencing severe budgetary pressures that are rising from the historical lump sum settlements of medical legal claims in the context of fiscal constraints. That's a WhatsApp message that they've sent through regarding that.
I mean, that's astonishing that you can't feed people because of medical legal claims. Something has gone horribly wrong. Very quickly, Nceba, we are, of course, watching COVID cases across the country. It's a quick opportunity just to find out from you what is happening with COVID in the Eastern Cape.
Well, the vaccination programs are running as we speak, and tomorrow, actually, I'll be doing an update of how far the province is regarding the vaccination. Also, listening to an interview that was done by the Premier, Oscar Mabuyane, during the week, where he mentioned that over 2 million population of the Eastern Cape is already vaccinated, and he's still making a call to the Eastern Cape residents to come forward and be vaccinated. And tomorrow, actually, that will be a story that I'll be following, just to make sure and update that how far is the Eastern Cape as we are going through the festive season, where a number of people will be flooding from all over the country, coming back for holidays. And this is a really tough time during this time as the country is experiencing the fourth wave. And I'll give an update about that tomorrow.
Thank you so much. That is our reporter Nceba Ntlanganiso coming to us live from East London this evening.